say?
Can you guys all say team say on 3? 1, 2, 3.
Hi, I'm Marianne, the producer of Dr. Libby's World of Medicine and Teen Say. Today, we're here with Mr. Bones. We're going to see Dr. Chris Bruno, a chiropractor. Has he adjusted you much? You're looking pretty stiff. He's a bone specialist, I hear. Let's go see Dr. Chris Bruno. Well, Dr. Bruno, you're adjusting the neck. We won't talk to him right now. Did that hurt?
No, not at all.
Okay.
It's actually, no, I've been coming here for 20 years.
20 years, wow.
Yeah. I herniated disc lifting.
Weightlifting?
I was weightlifting. I ruptured my L3, L4. Everyone recommended surgery, and he fixed it.
Wow.
So he was able to. No, never had surgery. Then I got in a car accident. I got T-boned about 12 years ago. Like severe concussion. My neck's all messed up, back's all messed up, and again, I did have to go get the whatever shot in the back. But at the same time, Chris was able to take care of it and fixed it again. So yeah, so I'm bringing my boys in because I think he'll do a lot of good stuff for him. He's done dry needles, different areas, like to help me for the different pressures, and also helps advising on some different natural medicines to take, different vitamins to help with digestive systems and things.
And it's helping?
So yeah, absolutely.
Wow.
Yeah, he's done a really great job. I mean, I'd probably recommended 24 people here.
Wow.
So, and everyone I know has come in and had a really good response.
Great. Thank
So,
you so much.
yeah, no, it's again, I'm a firm believer in it. I would have had to have full-on back surgery.
So how did you get persuaded to go chiropractic versus?
I had a friend who used them because he used to be over at the gym, and he had an office there. And my buddy said, I was like, I can't move. He goes, you know what? To go relieve pressure.
Move over, Dad, and show us the boys getting their first adjustments. We're going to interview them after.
So this is AJ. He's my 14-year-old, going to start high school.
So are you nervous, AJ?
Not really, no.
Any problem when I do this? Nothing?
Well, what do you say?
Any problem?
No.
Okay. Great. Let me have you on your side. Push up.
I even had one time where my back went out in New Orleans. I went to the chiropractor. While Chris does this and puts it onto the area and able to work it. The guy didn't know how to do it, so he actually helped him over the phone to fix my back.
Wow.
So.
Push up.
Chris, I heard somebody tell me that their chiropractor adjusted them over the phone.
Yeah, that can't be done.
Any problem when I do this?
How did that feel?
Good, very good.
Was that scary?
No. He's a goalie for lacrosse. There's nothing scary to a goalie who plays lacrosse.
Awesome. Cool.
All right, tell us, both of you, stand here. Tell us about your first adjustments. I want to hear it. Go ahead, AJ, you're first.
It felt really good and very satisfying.
Yeah?
Yeah.
Do you feel more limber?
I feel
Flexible?
more relaxed, yeah, I'd say.
I just feel great. Like my neck's
Hi,
been
Ben.
like, yeah.
I saw you do your neck. I don't know if
Yeah,
Tom got
because
that.
like hasn't been like we were at the beach 2 weeks ago and I had to sleep on the ground the entire week.
Yeah.
So this like made it a lot better, to say the least.
Wow. Okay.
Yeah.
So would you recommend this to your friends? Would you play a sport, Ben?
Yeah, I do. I play lacrosse too.
Oh, so you guys both get knocked around and hit with sticks and stuff like that?
On occasion.
What grade are you in, Ben?
I'm going into junior year.
Okay, wonderful. So what did Dad just said, hey, come on down, and you knew how successful it was, or what happened?
Yeah. I came down to get breakfast this morning. He said, I'm going to the chiropractor later if you want to come. So I said, sure, why not?
AJ's been hounding me for about 2 weeks to get to the chiropractor.
Yeah, because my back's been really tight and hurting lately. So.
Yeah, growing pains and sports and everything else.
Wow.
and too much time sitting at his gaming table playing.
Yeah, I was going to point that out to you.
So you
Oh,
guys
no,
are
wait till they
eager to
leave
go
that.
back to school. Are you scared about COVID?
We're online, my school.
Oh, you're kidding.
Yep, we're full online for who knows how long.
How do you feel about that?
I'll see how it goes. In the spring when we did it wasn't really like we actually did anything.
Yeah, they made it optional for Fairfax County.
That's what I
They did it first, and then they said everyone's going full on.
Yeah.
They first said we're gonna do.
You
we're
can
gonna
either
make it
choose 2 days in school, 2 days out of school, or straight online, but then they decided that it was just going to be straight online.
Yeah.
Wow.
And then
So
they
what
canceled.
about sports? Lacrosse is done.
He's been playing the entire
Yeah, I've been
summer.
playing. They had a club lacrosse this summer, but
Wow.
everything's pushed back to the spring now for sports.
It was up in Howard County, opened up the county, and it's funny they shut the stands.
I'm trying to get distance from everybody.
They shut the stands, but they allowed people to go.
Right.
So then it made more people just get crowded on the fence versus being able to sit in the stands that were wide open. We're like, that made no sense. So, it is what it is. But I was happy to have it. I was happy to watch sports again.
So what would you guys recommend to your friends?
I would recommend doing it because I think it helps a lot. It seems, but
Especially for a lot of people, because like they don't really feel like all stretched out and everything. This will really help them out. Especially people who've just been sitting around doing nothing this past 4 or 5 months.
So what's your name, Dad?
Eric Sackwitz.
So Eric, are you exercising now?
Yeah, so I'm walking a lot, doing a lot of walking. We do have some weights in the house, been working out some there. And we have an elliptical machine. His gym just opened up, so he's been going social distancing and masks. And so yeah, and he does his, they do a lot of jump roping, box jump stuff, and negative weight stuff like pull-ups and sit-ups and push-ups.
Wow. Anything you want to tell everybody out there about anything?
No, just good. I would just highly recommend if you're an active or inactive. I mean, I've been doing this for 25 years, and I don't think I'd be walking without it. I'd have had surgery. I'd be in a whole bunch of mess, and I think it's great.
Awesome. Thank you, guys.
Yeah, no problem.
I'm so glad we ran late today.
Yeah,
nice
no
to
worries.
meet you all.
Happy to do it.
Yeah, maybe we'll get you guys on Teen Say.
Maybe.
All right. Thank you.
Cool.
So, how long have you been a chiropractor?
25 years.
25 years. Wow. Do you like it?
I love it.
This
Can't
is-
imagine doing anything else.
This is your own office?
My own.
What's it called?
Bruno Chiropractic Arts Center.
So why is it called Art Center?
Because chiropractic is an art.
Oh, okay.
And it's
Why?
what you do because you're working with your hands. You're correcting things. You're basically remolding a human when they're out of shape.
Okay. So what degree do you study to become a chiropractor?
You study a doctor of chiropractic,
Okay.
but you do a lot of undergraduate school as well.
What do you do in undergrad? Kinesiology?
Physics, biology, chemistry, all that stuff. All the basic stuff that you have to do for med school, you have to do for chiropractic college.
Okay. So how long does it take to become a chiropractor?
Initially, you have to do your undergrad school, which can be done in, you can do it in, well, now it requires a 4-year degree. When I started, it was a long time ago, but they used to have just prerequisites. Now you have to have a 4-year college degree to graduate before you go to chiropractic college. And then chiropractic college is for another 4 years. So about 8 years.
Wow. Okay. And then an internship?
You do your internship in chiropractic college. They have a clinic set up, and you bring in patients, and you work on your patients, and it's overseen by clinical doctors right there in the center. So.
At what age did you know you wanted to be a chiropractor?
I don't know, I guess it was like 25.
What made you decide?
I was in a car accident.
Wow.
So,
Okay.
and I was in a back brace and going through the orthopedic stuff with pain meds and physical therapy. And I went to a chiropractor, and he adjusted me a few times, and that felt great. And I was like, wow, I think this is something I want to do.
Wow.
So,
Lie on your side, face me. Same thing as Justin.
So I was telling him, so, when they go through going through the medical and at an ortho or internist.
Uh-huh. Oh! Beautiful. Face down.
Oh, wow. I was going to say traction hurts a lot, but that looks like it hurts. How did that hurt? How did that feel?
How was that, man?
It's fine,
Yeah.
but you know, when I walk, it's just like right over in this area here. Oh,
On your back?
that pain referred down to in here.
Okay.
Clean?
Yeah. Alright. Leg straight. Push up. Push up. Try this one. Push up. That one's good.
What year of college were you in during that time, or were you done with undergrad at that point?
I don't even think I was in college at the time. I was only
Okay.
maybe 19 or 20 years old.
Oh, when you had the car accident. Okay. Wow. All right. That's exciting. I didn't expect that answer because everybody's journey is different. But what I have discovered is a lot of doctors decide to become a doctor because of either a family member or
Sure.
something that happened to
No,
themselves.
I had no family members.
Yeah, no, just you. Wow. There must have been some car accident.
It was.
Yeah.
I missed my trans ham.
Oh, no. Totaled, huh?
We tried to fix it, but it never happened.
Yeah. Oh, wow. Okay. Yeah, we hear a lot about kids doing crazy things, you
Well,
know.
I wasn't doing anything. I was sitting at a light.
Oh, no. T-boned?
Rear-ended.
Wow. So older people say that when they are fed up with medications and just being in pain all the time, they find a really good chiropractor and it changes their life.
Mhm.
And I've heard a lot of that. I've heard a lot about the oils and various things, but why, how can you take someone of an older age, like maybe 60s,
Mhm.
70s, 80s, and change their life when their bones are already,
Well, you can. There's various ways of adjusting the spine, and the way you adjust an infant is not the same way you would adjust a teenager versus adjusting a senior citizen. There was a RAND study done many years ago in which they did a study on the population of senior citizens, and what they found is that they used the medication in hospitals less frequently than the group that did not use the chiropractor. So, in essence, going to a chiropractor as a senior citizen would save you money.
And pain?
No, I have a lot of senior citizens that we treat all the time, so
No, but it alleviates their pain.
alleviates the pain, reduce their medications that they're taking, less frequent visits to the hospital, less frequent visits to the medical doctors, so all around it just improves their health.
So how can you tell? So somebody comes to you and they're like, oh my gosh, I have this stomach pain, won't go away, and, I don't know, right under here hurts. And how can you tell internally, or they have Lyme disease? I've seen you do that on patients where you take these little bottles. How can you tell what's wrong with someone internally when you do an exam?
When you do an exam, you're just basically, you're trying to see if there is a problem and if they are going to react to a certain situation or to an energetic vial when you do energetic medicine. Got a minute? And then, but you won't know unless if you find something, then you can refer them out for advanced tests. And there's a bunch of advanced tests now for Lyme disease that patients can take, and also for intestinal problems. We use a company called Great Plains, and they do a lot of more advanced tests that most medical doctors don't do in their offices.
So are those considered homeopathic doctors?
No, the tests are just basically it's a lab. It's like going to LabCorp for blood work, but these guys do more advanced diagnostics for your stool, for blood, for saliva, and they'll do hormone testing, parasite testing, and also test for Lyme disease.
So you mentioned something that started with an M when you're working on patients to feel also what's wrong with them internally.
Meridians?
Meridians.
Yeah, Meridian Therapy has been around with Chinese acupuncture for centuries. It's 4,000 years old. So, but in kinesiology, we kind of muscle test the meridians rather than doing pulse diagnosis. So with meridians, they do the pulse diagnosis in Chinese acupuncture. We just kind of use muscle testing to see if we get the same kind of response.
So what are you doing?
Lidocaine?
No, it's just a little alcohol to clean it back. So I'm gonna stick a couple of acupuncture needles in you.
I sure grabbed up.
Nah, you won't even feel this.
What is this gonna do?
So his muscles are in spasm, so we're basically gonna just put some
Whoa!
needles right in the
Good
spasm. And
That's like, it's
then
like jolt, but that's it.
each needle will create a little lesion, and then the body will come along and heal it and break down the muscle spasm.
So this does like an electrical current too?
Yeah, we're just basically hooking up the acupuncture needles to a TENS unit. And we're gonna turn them on. Let me know when you can feel it.
I can feel it.
Is it strong?
No, it's just a little slight. Just feel them?
Okay. Is that good?
Yeah.
All right. Let's do the other side.
Oh, yeah.
Is that good? Strong? Comfortable?
Comfortable.
I can go higher.
Give me an example. What could you tell by doing a meridian test on someone?
Just basically that the meridian is off. So somewhere that the meridian is off or it's out of balance. And what you're doing with acupuncture is you're using needles to balance the meridians in that body. What you're doing with chiropractic is we're just doing the same thing, but we might try different things. And we might use acupuncture needles or just use balance the muscles or fix a muscle that might be associated to that meridian.
Okay. What is the meridian?
What do you mean? Every meridian, like all your organs have a meridian. So the liver meridian, lung, spleen. So there's
Okay.
12 meridians, so there's all different meridians. And then governing vessel and
Okay.
vessel as well.
So, with chiropractic adjustments and so forth, do you do a lot with nutrition and vitamins as well?
It depends. Like, yes, if the meridian is out of balance, you can also use nutrition as part of that. But it's always going to be specific to what you find. So if there's a muscle involved, we'll try to find the nutrient that would balance the muscle to fix the meridian.
And a vitamin?
Sometimes it's an herb.
Okay. Okay. So, would you refer a very sick patient out to a homeopathic doctor?
I'm not big on homeopathic. If the person is very sick, I would refer them to my primary care first and have them do some advanced blood work up and go that route before I would send them for homeopathics. I'm just not really keen on homeopathics.
Okay, so that's surprising to me because I thought chiropractors and
some
homeopathic
people
go
love
together.
homeopathics. I just don't. I've never really delved into it.
So it's different. Okay, so what does a homeopathic doctor do? They just
Well, homeopathics, to explain what a homeopathic is, so a homeopathic remedy is basically a weakening of a poison, basically.
okay.
So they take an herb that
Okay.
might be harmful to the body and it's diluted down over and over and over to make it minute. So it stimulates the body to do something. So to give you an example, let's say it's
Please.
say it's you went out to dinner and you had coffee at 9 o'clock and you get home and now you're all wired and you can't
Yeah.
sleep.
Yeah.
Theoretically,
Happens to
if you were to
everybody.
take one drop of coffee into a glass of water to dilute it and drink it, it's supposed to counteract the caffeine. So basically all you're doing is creating a weakening poison of caffeine to the body to make it stimulate the opposite way.
Wow.
That's the best way I can explain homeopathy.
Okay. Okay. Wow. Okay.
And there are people that love homeopathy. I mean, I just never really got into it.
Right. So what's been your worst case that you've had your worst, I don't know, patient that's really been serious and given you a run for your money?
But most of those are always going to be Lyme patients. So,
Lyme?
Yeah.
Oh, really?
So they usually have the most things wrong with them. So we'll find some intestinal situations, some stomach situations, large intestine. And once we balance that out, everything works out pretty good. But it takes a while sometimes. I mean, you're putting them on you want them on as few supplements as possible. And a lot of times people come in with a basket full of stuff and
Yeah, they're on a lot of medicine, right?
or supplements, and you're trying to just you'd want to eliminate as many as possible and just put them on 1 or 2 supplements, and that's it. And just keep them on that, and just follow up with them every week.
Okay.
And that's the key. So don't give them a bunch of supplements and send them out the door. You know, you got to do it every week, and you got to follow up and see what's going to happen with them.
So I saw some pictures on the wall, so you see a lot of athletes as well.
Chiropractor, I've taken care of a few, yeah.
Yeah? So when an athlete comes to you, you're understanding to the fact that they want to get right back in the game?
Correct.
Okay. Because versus going to an orthopedic that might, there are sports orthopedics that help them get right back.
Yeah, and some don't want to do all the steroid shots, some can't do the steroid shots anymore. You know, so.
Right. But then there are other orthopedics that say, oh, you have to, you know, sit it out for 12 weeks, and the kid's like,
sure,
what?
Sometimes that's what they got to do, but
yeah.
We're about find it, fix it, get them back to function as fast as possible so they can do what they enjoy doing. And that's even in everyday life. I mean,
right.
You know, you can sit at home with the pain, or you can get back in the game.
Yeah, for sure.
So.
I guess it's never too late to get your back in shape and start exercising, because you hear a lot of middle-aged people say, well, you know, I just wasn't an athlete like my kids, and now I can't all of a sudden get into shape. And my big thing is, well, maybe you should go to a chiropractor, see if he can loosen you up a little, and then start gradually exercising.
Things catch up very quickly if you don't do anything about it, and it's very hard to get back into that situation. So, you know, at first it becomes mindset. It's mind over matter what they got to do, and if they don't do it, then, especially in what's going on right now with COVID, if you don't get your butt in gear, you could be part of the casualties.
Yeah, for sure. So it's never too late?
Never too late.
Good. Yeah, you hear everybody saying and bragging that they're gaining the COVID-15 and they're baking constantly.
Right.
Like my daughter said, why is everybody making banana bread? And I said,
maybe they think the bananas are good for them, but I don't, you know. But it should be, you know, they should get more active into their lifestyle. I mean, that is a given thing. This is what COVID's telling everybody right now. You need to start getting active.
Right.
So,
are there certain vitamins that you would recommend for COVID?
Yeah, vitamin A, vitamin C, vitamin D especially, those 3. Vitamin A, you know, about 2,000 IUs a day, vitamin D about 4,000 IUs, and vitamin C 1,000 milligrams twice a day. And that should help out a lot.
What do you feel about the multivitamins? I know you're
not a big multivitamin, because again, it's a bunch of stuff put in the pill and it's minimal.
Okay.
So it's not, you know, I mean, yeah, is it going to hurt you to take a multivitamin? No. But there are things in the body that need specific nutrition. So like the heart specifically needs coenzyme Q. So that's very important for heart function. So if you're an athlete, you should be always taking that, because they're burning up, you know, they're functioning that heart and putting it to max use. So CoQ10 is an antioxidant for the heart. So it's important for that. Just like probiotics for the intestinals, you know, everything's specific, and you can't get all that in one pill.
So you're just doing physical testing of these people to determine what they need?
Yeah. Versus,
I've heard people have to do the saliva and the hair testing?
They can do that, but that's just going to show you what you're deficient in, sure. And you could do that, it's a little bit more specific. We have a tendency to just use it, testing under the tongue, so we have the patients usually sublingually test it, taste it, and muscle testing for that, basically kinesiology.
So you do that here too?
Mm-hmm.
Okay. Do you do a lot of that, or do you stick to just trying to figure out the muscles and what's ailing them?
Well, it all depends what the patient needs and what the patient wants and what their outcome wants to be.
Right.
I mean, if they're in here for just wellness, then we take them to a different level. If they're just here to get back pain fixed, then that's what I'm doing.
The big controversy, Cbd oil. Can you tell us, a lot of young athletes are getting that now, and they get these little packages, or it's handed out at Spartan races, and when we were having Spartan races,
right,
and Tough Mudders. Can you tell us a little about your feeling on that?
Yeah, I think CBD oil is very good for pain and also for anxiety. There is controversy on whether or not, if you're a federal employee and you get drug tested, whether or not it would come up positive. It's kind of like a lot of disparity on that, so we really don't know. But if you don't have to take a drug test, and you do have things like joint pain, then yeah, I would highly recommend, especially if you have arthritis. It's a good supplement to take, along with omega-3 fish oils as well.
So would you recommend, like they have the oils that they're rubbing on the kids after races? Isn't that like an overkill? I mean, they just had a race; they should be hurting.
I don't think
gain.
CBD oil is absorbed through the skin. In order to have something absorbed, you have to have something that kind of binds to it. And most of the time, we're using stuff like DMSO. So if you're using like a patch, okay, like the nicotine patches and stuff, is something is driving that into the skin. CBD oil is not having anything drawing it into the skin, so it's kind of, the topical stuff has things in it besides CBD oil, and that's probably what makes it feel better on the joint, but the CBD on the skin would have absolutely no effect.
Wow. Thank you.
You're welcome.
Do you want to recommend anything to athletes after they do a Spartan or a Tough Mudder besides a lot of water?
A lot of chiropractic adjustment and a massage.
Awesome. Thank you so much. Right. And as far as massages, so I know every office has a massage therapist, and there's different kinds of massages.
Yeah, there's some do deep, some do light. I mean, I'm more.
And then there's for stress.
Well, but again, it's just whether they want a deep tissue massage or if they want to do it light, and I'm more of a light massage rather than deep tissue, but that's just me.
Okay. So what would be the purpose of someone that's never had a massage getting a massage?
Well, it pushes a lot of the built up toxins in the muscle out. So sometimes when you do it, you can feel a little nauseous if you've never done it before, and you're especially a person who doesn't have a good diet. You're going to be pushing all that out into the bloodstream, so they might feel a little bit nauseous. So we have them drink a lot of water throughout that day. Try to flush the toxins out of the body, because you're getting that all out into the bloodstream.
Is that why all massage places have big things of lemon water?
Probably.
I thought they were just being nice.
Yeah, we use alkaline water. So.
Okay, so there is a reason. Mm-hmm. Okay, that's interesting. All right. Bruno, what is that? Does that help with the viruses? You always have that going in your office.
It's an essential oil diffuser, and we use tea tree oil, eucalyptus, peppermint, and rose oil. And it's supposed to kill viruses in the air. So whether or not it works, I don't know, but I'll take every chance I can to prevent COVID.
For sure. And where can they get something like that?
Most diffusers, you can get them on Amazon. All the essential oils you could probably get on Amazon as well. We use a mixture of different things. This is just some stuff we got off of Amazon, but we also use doTERRA as another one, and Young Living is another one.
Okay. So do you use a lot of the oils?
And the diffuser, yeah. I just like the way they smell, and like I said, it's all about prevent. So I'll do whatever I can.
Any advice you want to give the kids out there about becoming a chiropractor versus an orthopedic or a medical doctor?
I mean, it's what their niche is. They got to fall into that themselves and find out what they want to do. I mean, I could be happy being either one, but I love being a chiropractor.
Making a big difference?
I think so.
Yes. Great. Yes, you're one of your patients waiting. Yes. Well, Dr. Chris Bruno, thank you so much for talking to us today. Do you ever take interns?
Yeah, I've actually had chiropractic interns come in here from colleges, and also some students from high school that were looking at becoming a chiropractor. So I've had them walk through with us. And I even had a few medical doctors that were doing interns at Reston Hospital actually came through to see what we were doing.
Oh, awesome. And sometimes, do you work with orthopedics?
Oh, yeah, absolutely. Yeah.
They do send you patients when they feel like
you them. If I can't fix them, I send them to an orthopedist.
Awesome. Well, thank you so much,
You're welcome.
Dr. Chris Bruno.